Okay, once you have your vamp primed, then you can go ahead and prime your Swan itself. So you take it out of the cardboard box and then out of this initial plastic wrapper. Okay, and now there's going to be two sides to this. This top side that says open here is your nursing side. This bottom side is going to remain sterile because that's what your doc is going to touch. Okay, so all of these you can touch once you open it. So we're going to peel back only this half. Okay, that was not graceful, but whatever. Main thing is that's like that. All right, these are the cables that are going to actually hook to your hemosphere. You do not need this hooked up for the insertion. All you need is your pressure cables and your screen on your monitor, so we can ignore this for now. Then you are going to hook up your balloon syringe to the balloon port. Okay, like so. Then you're going to take your CVP or your blue part of your vamp and hook it to the CVP or blue part of your Swan. And then you're gonna take your PA or your yellow part from your vamp and hook it to the yellow part of your Swan. You'll also need a regular flush and a cap to go onto your VIP port. I'll get that on there. And it'll hook to this white VIP port here. Okay, so you can prime it before. I like to prime it before the doc asks me to, and then I'll just show him after. So flip it over real quick, and I make sure I prime the VIP port. You'll see it'll come out in fluids coming out there. So don't do it all the way, just a little bit. Then you want to pull your CVP port, and then you'll see fluids coming out there. And then your Swan port, and you see fluids coming out there. So now we're all primed and ready to go. So when the doc is ready, what you're gonna do is you'll open the rest of it for them without touching it. I just flew water all over. Not touching the catheter itself. They will grab the catheter and they'll ask for you to show them, okay, flush my Swan, flush my CVP. So I'm gonna pretend I'm sterile like a doctor. So they will grab this out of here, right? They're not touching any of that stuff. And they're gonna say, okay, show me the CVP, and you would pull your blue, okay? Show me the PA, pull the yellow. Show me the other port, the VIP port. Okay, so they know it's all primed. They'll also ask you, I should have put air in this first. This only goes to the dot. There's a little, you can't put any more than 1.5 mLs in there. Okay, and they'll also ask you to show them the balloon up and balloon down. Okay, they'll test it before they put it in the patient. Then as they insert it into the patient and they're looking at the monitor and the waveforms, they'll tell you balloon up. So it's your job to balloon up. You just hold it there, and then they'll tell you balloon down, you let go. And that is what you do during the insertion.
After the Swan is inserted, you can hook up your cables to the PA catheter. The red caps can be removed and these attached to the PA catheter. And then this clip goes into the oximetry line.